crisis right now. We want to bring in Seth Denson. He's a healthcare analyst and author of The Cure, a blueprint for solving America's healthcare crisis. Seth, obviously a lot to discuss here, a major role that health insurance is going to play as we continue on learning more about this virus, as more and more people are getting tested here. How much of everyday Americans' insurance is going to cover, these testing kits and treatment as well for coronavirus, and are they prepared to do so?
Yeah, I think we'll take the first part of that question, which is what will insurance cover and not cover. And I think that, 16 states have currently passed legislation requiring health insurers in their states to cover this. 13 more states have legislation currently in the work. The bill that has come out of the House of Representatives from a federal mandate will require insurance companies to cover doctor-directed testing, and I think that's an important clause there. It has to be directed by a doctor as we start to see the private sector get into testing. And so those things are going to be covered 100%. Where I think there's some confusion is where treatment might be covered, because right now there's nothing that says that the treatment of coronavirus would have to be covered at 100%.
I want to ask you this because Senator Chuck Schumer there on the Senate floor outlining quite a bit, unpacking quite a bit, and one of those was phase 3, and he had 4 points to this. And the one I want to ask you about here, Seth, is he said unemployment insurance would be one of the main priorities of phase 3. How important is unemployment insurance right now?
Well, I think it is important, and it's something we absolutely should consider. Again, we got to understand that the federal government, in many cases, or at least state and local government, I should say, has put many employers on lockdown. Right? So as you start to see bars required to close based on city ordinances and potential state ordinances and things like that, these are things that the average American citizen has very little control over. And so it's important that the federal government step in, at least for a short time, and provide a safety net for those that are going to need it the most.
And Seth, what about people with self-funded plans or even those without insurance right now? What's their best approach for seeking treatment or getting tested?
Yeah, that's a great question. And this is a thing that I think a lot of people are kind of glazing over. Remember that the states still set standards for most health insurance companies, but these are what we consider to be fully insured insurance companies. Many employers in the United States, and it's estimated that roughly 100 million Americans are covered by self-funded plans, which means that they don't necessarily have to abide by certain state regulatory mandates. They're more based on what the federal government's going to require. So this bill that's coming out of the House of Representatives is going to be imperatively important so that employers have to cover the testing component at 100%. Now, what's not covered in this bill is the treatment. So Americans need to be prepared that if they are one of those few Americans, and I can't stress this enough, it's estimated that very few Americans will have to seek critical treatment for coronavirus, but that their normal deductible and co-insurance very well might apply based on how their insurance policies work.
So is that something that possibly needs to be implemented in one of these phases, Seth? Does not only the testing being covered by insurance providers, but also the treatment? Do we think that that needs to be involved in these phases as well?
Yeah, that comes into a much deeper conversation about the overall financial structure of the insurance markets and in the self-funded markets from employers. Remember, if employers are self-funding their plan, they may already be somewhat strapped for cash. And so we need to keep those conversations going and understood. Remember, though, the number of people that will need critical treatment that's going to cost more money is going to be relatively low. The insurance plan will still cover it. It's just does the deductible, co-insurance, and co-pays apply? The other thing that I would make sure to stress is out-of-network charges. There's a lot of conversation before coronavirus outbreak about surprise billing and out-of-network charges. The federal government needs to step in and make sure that those shenanigans are off limits.
Hey, Seth, another thing, obviously no one can predict when a pandemic is going to strike. And, we'd heard the start of the coronavirus, obviously, and continue to see it get worse and worse as months go on. Are the insurance companies prepared to deal with this?
I think they are. Listen, insurance companies, just from a financial markets perspective, have done quite well over the last decade, recording record profits. So I think from a financial perspective, they're okay. Again, and I've said this now a few times, I'm going to stress it again, While this may impact a lot of people may contract the coronavirus. I say a lot. We don't know those numbers. The number of people that will have serious conditions and need to seek serious healthcare treatment as a result is expected to be relatively low. And so from that perspective, I think the health insurance companies from a financial perspective are going to be fine.
All right, that's Seth Denson, healthcare analyst, author of The Cure, a blueprint for solving America's healthcare crisis. Seth, thanks so much for coming on.
Thanks.